Against COVID-19, Pfizer is now seeking FDA approval for an experimental antiviral pill that it says can significantly reduce the number of COVID-related hospitalizations and deaths.
Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health, is joining us live now. Thank you, Doctor, as you join us every week. We truly appreciate it. Let's ask you about this. If a pill to treat COVID becomes available, would we even need vaccines?
I'm glad you asked that, Maria. I'm getting that asked a lot, actually. It's not either or. We want both. The vaccine is preventative, and the treatment is therapeutic. So we want both. You don't want to just roll the dice and take the chance that these pills are going to work. Remember, whether it's Merck's pill or Pfizer's pill, the range is between 50 to 90% effective at reducing hospitalizations. That's very good, but it's not perfect. So we want both. We have to attack this virus on multiple fronts.
Dr. T, let's get to some viewer questions. New cases of COVID-19 are rising again here in Massachusetts and many other states in the union. So our viewers do have a lot of questions. Hannah writes in and asks, I got the Moderna booster after getting J&J. I didn't realize it's only half of the regular dose. Do I need another shot?
Well, let me tell you something. Hannah is asking another very common question. The answer is no. The good news is that half-dose Moderna at 50 micrograms as opposed to 100 micrograms gives a very similar immune response. So all you need is 50 for that booster.
All right, this one is from Valentina, and she says, do you know if COVID can travel through a building's heating system?
The good news, Valentina, is that the answer is no. There's been no evidence that COVID travels through heating units or air conditioning units. In fact, there have been a number of studies, one particular from South Korea, that showed an entire call center building that had virus in it, and it got limited to one floor. Not only one floor, but on only one side, which really shows that COVID is traveling over short distances. Yes, it can be in the air, but again, over short distances, not through entire HVAC units.
This question comes to us from Francis, and she asks, I am eligible for a booster shot. Should I get tested for COVID before my appointment? And what happens if I get a shot while I have COVID?
All right, so the first part is no, you don't have to get tested if you feel well. Obviously, if you're sick with respiratory symptoms, yes, you want to get tested because we don't want to unnecessarily expose anyone. As far as if you're infected, the CDC basically says you can get vaccinated at any time after recovery. So it's generally about 10 to 14 days. But one thing I will say is we know that if you get vaccinated soon after you're infected, you're more likely to get more symptoms. And that's probably because it's a combination of the virus infecting you and the vaccine. So while generally speaking, there's no significant harm because we know a lot of people have been vaccinated shortly after getting infected. But the bottom line is, ideally, I usually tell my patients to wait about 6 weeks or up to 3 months after.
All right, and the last one tonight is from Jason, and he simply wants to know, how long will I test positive for COVID after having COVID?
Well, Jason, I think the important thing to know is you don't want to keep getting tested after you're positive. Once you start to feel better, usually after about 10 days or so, you're ready to get back out into the world per our CDC guidance. If you do get tested, because our tests, especially those PCRs, are so sensitive, you can actually test positive for weeks or months after, but that doesn't mean you have active virus. That PCR test doesn't distinguish active infection from dead virus. So the answer is, generally speaking, once you test positive, you don't really have to test again to be negative as long as you're feeling better.
That's a great clarification. Thanks, Dr. T. Great to see you.
Be well, doctor.
Take care.
You too.